My name is Rachel Ellis, and I've been covering health for the British national newspapers for 17 years and have worked for a wide range of publications. I also edit in-house magazines for the private HCA group of hospitals. Health is a subject that touches everyone, whether it's your own personal health or that of a family member or loved one, and as a result, it generates a huge amount of coverage in the media. You only have to look at the plethora of health magazines, health sections, and health stories in every national newspaper to know what an important subject it is to TV, newspapers, their readers, and viewers. The challenge for health journalists like myself is to work out the importance of a new technique or trial data, and then convey what is often very complex surgery, treatments, or research in a way that's both accurate, interesting, and accessible to the general public. Of all areas of medicine, surgery is probably one of the easier health issues for people to understand. Going into hospital, having an operation, and recovering is far easier to grasp than multi-stage cancer treatments or immunotherapy. Surgery can cure people. It's also exciting, pioneering, and high-tech, and as a result, the media loves it. Who wouldn't be fascinated in being able to remove a brain tumor through a patient's nose in order to save their eyesight, or having keyhole surgery to fix your heart rather than through a large incision? The media, like the public, is on the whole very supportive of surgery and surgeons. You make us better and have the trust of 89% of the public, according to a British poll last year. But we could work better together. Journalists are a lot like surgeons. On the whole, they do a good job, but the bad ones can give the profession a bad name. Most journalists are not there to trip you up. So the key thing is to work with them to get your message across. For many years, surgeons and the medical profession in general have been seen as a profession that clams up when things go wrong. But that is changing, and greater transparency and a willingness to engage with the media goes a long way to ensure reports are accurate and honest. For example, recent media coverage in the UK has turned to high death rates among patients admitted at the weekends to some of the country's largest hospitals. According to data released by the Information Services Division, which is the government's health statistics unit, mortality rates following emergency treatment in the fields of vascular surgery, renal medicine and neurology peaked on Saturdays at several hospitals. The suggestion was that patient safety was being compromised by an underpowered health service at the weekends. While the initial reports were no doubt unpalatable to surgeons, in response, the president of the Royal College of Surgeons did an interview with a newspaper explaining what he called the mayhem consultants found on Monday mornings, and how he was going to tackle it by enabling hospitals to operate 7 days a week. It resulted in a second article with the headline, "Operation to End NHS's Monday Mayhem is Underway," and surgeons were painted as a profession who wanted to make things better for patients. So a negative story was turned around into something with a more positive outcome by engaging with the media. The media is reasonable on the whole, but they need help explaining complex issues. Journalists face many challenges when it comes to health reporting. On a daily basis, they're translating lengthy and complex reports into a few hundred words that can be easily understood in a very short space of time. So taking a lofty approach is never going to help get your message across. In most cases, journalists themselves are not medically trained, and personally, I think this is a good thing because it forces you to take the viewpoint of the patient. With the constant flow of press releases from medical journals, charities, hospitals, and universities, it can be difficult to work out what really is an advance or a breakthrough and what isn't. All these sources want their stories published, and they want positive headlines to raise the profile of their organisation or staff or to help with funding. And negotiating your way through these considerations can be a minefield. If surgeons refuse to speak to the media and explain their work and its implications for patients, or do so in such a way that it is unintelligible to someone with that's not medically trained, then it's not surprising that misreporting happens. Of course, there will always be journalists who are determined to hype up a story or make a scandal out of something, but on the whole, journalists do try to get a balance. Journalists are only as good as their last story, and no one wants to get a bad reputation. Conversely, a report that is too technical or bogged down in detail that most people don't understand will at best never be read and at worst never be published. It's all about balance. Media reports are not medical journals, and nor should they be. They use language that non-medical people can understand and are portrayed in a way that is interesting and catches people's attention. Surgeons can get very upset that precise terms are not being used to explain their work, but not using a technical term is not dumbing down your work. It's making it accessible to everyone, and surely that has got to be a good thing. The media also has deadlines. It's simply the nature of the job, and articles will generally run whether you get back to a journalist or not. And if a journalist can't get hold of you, then there is a greater chance of misunderstandings or misreporting because they only get part of the picture. In your busy day, the last thing you probably want to do is to speak to a journalist, but just 5 minutes can be highly beneficial. My advice when dealing with a journalist is always make sure you get their name and contact detail, and you can ask them if they would read over to you any quotes that you give them. Not all journalists will agree to do this, but especially when covering complex or technical issues, journalists are often very grateful for the reassurance that they've correctly understood the issue. By understanding what journalists need and helping them to achieve that, you'll get a lot better coverage in terms of the media. So what does the media consider a good outcome for patients following surgery? Ideally, the patient should come out of surgery with their problem cured, or at the very least in better shape than before they underwent the procedure. Fully understanding the risks and benefits of surgery, possible side effects and expected length of recovery before undergoing the procedure is vital. The Enhanced Recovery After Surgery programme is a major step forward to making sure patients understand what is going to happen to them when they go in for an operation. We all know that when patients are stressed or receiving bad news, they often only hear what they want to hear, and even if the surgeon is explaining the risks, they don't take it in. Time and time again, I speak to patients who say they didn't really understand what the doctor was saying, but they didn't feel that they could go back and ask questions. By spelling out exactly what is expected, the Enhanced Recovery After Surgery programme really helps to address this problem. Secondly, surgery should be non-invasive where possible. Most patients would prefer keyhole surgery to open surgery because it speeds up recovery and leaves less of a scar. However, the surgeon must have the necessary experience and expertise to carry it out. Where surgery can be avoided altogether, for example, treating conditions such as tonsillitis and appendicitis with medication rather than surgery, then this is welcome too. Short hospital stays is another issue. Few patients enjoy prolonged hospital stays, and therefore the shorter the stay, the better. Advances in keyhole techniques and day case surgery means this is now possible for a wide variety of operations. However, a short hospital stay should not be at the expense of quality of care. Patients want to feel they have received all the medical care they needed, not discharged from hospital at the earliest opportunity to free up a bed. A low complication rate is also important. A good surgical outcome is one where as few complications as possible occur. Patients need to be made aware of the chance of complications occurring before undergoing surgery, and what both doctors and they can do as patients, both before and after surgery, to improve recovery and reduce the chance of a complication occurring. The clear and precise advice of the Enhanced Recovery After Surgery programme is a real step forward in not only spelling out the possible side effects of surgery, but getting patients actively involved in their own care and making them realise that there are simple things they can do both before and after surgery to aid their recovery. For too long, patients have had a passive role when it comes to surgery. They've gone in expecting to be made better, with little understanding that they too can influence the outcome. Hospital infections are also a major concern to patients and the media, therefore reducing the chance of picking up an infection during surgery or on the wards is very important. And finally, a low readmission rate. While patients want to spend as little time in hospital as possible, they do not want to be discharged only to be readmitted hours or days later because of an avoidable complication. Readmissions are costly and disruptive to patients. While patients and the media are realistic that complications do occur and there are never any guarantees that the operation will be a complete success, they should be satisfied that no corners have been cut that have resulted in an unnecessary complication. So what triggers media interest in surgery? Surgery and surgeons get considerable attention in the media, both good and bad. The vast majority of media reports about surgery are good ones. Every week there are stories about the latest advances in surgical techniques, improvements to patient outcomes, and new innovations. When it comes to deciding whether a story about surgery is newsworthy, there are two broad areas of interest to the media. The first is the groundbreaking surgery, which pushes the boundaries of medical knowledge. Advances such as a face transplant or separating conjoined twins will always generate a huge amount of public interest. These stories don't personally affect many people. They're often treating extremely rare conditions, but are fascinating and have that wow factor. The second area is advances in routine operations performed on thousands of people each year. It might be a new way of carrying out gallbladder removal, hip replacements, and heart surgery, for example. Or it might be ways of speeding up recovery following surgery. These stories may not have the wow factor of a surgical world first, but are newsworthy because they affect large numbers of people. The work that the Enhanced Recovery After Surgery Society is doing falls firmly into this category. We constantly hear about the spiralling costs of the latest drugs, equipment, and procedures. But many of the techniques you are using to enhance patients' recovery do not require vast sums of money. This makes them good news stories for the media on many fronts. Not only do patients get better care and fewer complications, but they're not costing the health service a fortune. Surgery can also generate bad news. In every profession, mistakes happen, but bad surgery can lead a devastating and fatal trail, which makes it more newsworthy than an office worker who makes an administrative mistake. While patients and the media understand that mistakes happen, it is unrealistic to think that the avoidable death of a patient will not be emotive and newsworthy. Readmissions following surgery is another area that generates negative press because it's seen largely as a failure of the system. The worry is that patients are being discharged from hospital too soon and when it is not in their interest, simply to free up a hospital bed. Last year, it was reported in the UK that the NHS paid out £5 million in compensation to patients who had suffered complications after being discharged from hospital too soon. One of the biggest frustrations of the media when it comes to surgery is the variations in access to the latest techniques or the best quality care. If the success rate of an operation is 95%, you want to be confident that 95% is the success rate of your operation, no matter where you are treated, who you are treated by, or what day of the week you are treated on. Likewise, if the best way to perform that operation is a minimally invasive approach rather than open surgery, then that is what all patients should be having. However, variations do exist, and from my experience, access to the best treatment seems to depend on the quality of people who are running surgical departments. If you have a dynamic surgeon who is keen to learn the latest techniques and organise the department in such a way that measures are in place to aid patients' recovery, then a patient attending that hospital will receive high-quality care. However, a patient attending another hospital down the road may have a completely different experience. The decision in England to publish individual surgeons' outcomes for the first time will go a long way to address these concerns. It will open up a dialogue between patients and surgeons and help patients to understand far more about the nature of surgeons' work. But publishing outcomes is a daunting process. No one likes to be personally named. However, the first set of results showed the overwhelming majority of surgeons are performing operations and procedures to a high standard. Fewer than 10 surgeons currently appear as outliers where their results are significantly different from others, and where further investigation to understand these data are needed. A great deal of work has been undertaken with the media to help them understand the complexities of these results. For example, surgeons who take on high-risk patients may have worse results, and treating the figures in a crude way would be unfair and may deter surgeons from taking on these difficult cases for fear of being penalised. To help journalists understand these figures, a series of briefings have been held by the Royal College of Surgeons and the Science Media Centre, at which clinicians and data experts explained what the information meant for patients and clinicians and how to interpret it. In summary, for most doctors and medical professions, having to talk to the media is like going to the dentist. It's an unwelcome chore, but it should be seen as a positive way of letting the public know of the fantastic work you are all doing. Thank you.